Hi, I'm Dr. Kerry D'Ambrogio, and the purpose of this video clip is to introduce to you the concept of positional release therapy. Positional release therapy is a passive, indirect technique. So let me show you what it looks like. First of all, what we do is we find a tender spot in this area. And in positional release therapy, we want to soften that area. So typically what we would do, we call it an indirect technique, as well as a passive indirect technique, because the patient is passive, they're relaxed. I'm doing all the work. So I'm coming in through here to soften the tissues. So when we do positional release therapy, we're finding a precise position that relaxes muscles, fascia. It can make changes in the joints. And this position is very comfortable for the patient. That's the whole thing. When we release these tissues, we actually create a better environment for healing because there's less swelling in the area, there's better circulation of arterial flow, venous drainage, and lymphatic return. Now, positional release therapy was originally developed by Dr. Larry Jones, who's an osteopath. He called it strain and counterstrain. I used to assist him when he did his teaching. Larry's no longer with us, and I dedicated my book to him. Now, when a patient comes in, how do we evaluate if someone does have protective muscle spasm, and how do we know they would benefit from PRT? Well, the key evaluation would be the palpation of a tender point. If someone has a lot of protective muscle spasm, when you go to palpate them, they're usually going to have a jump sign. We use a tender point scale from 0 to 10. Usually it's going to be like a 7, 8, 9, 10 out of 10. And typically there's going to be some kind of mechanism of injury. So if we were to look at a subjective evaluation, typically we're looking for what was the mechanism of injury. Is this acute or chronic? We're looking for some kind of trauma. Was this a sprain, strain type injury? When we go to our objective evaluation, we're going to go back to what we talked about in the introductory video, ARTS, A-R-T-S. The first thing we look at is the asymmetry. So here we have Angie. When she's lying here, the first thing I'm going to do is look for symmetry. We're going to focus just on the pelvis right now. So if I look at her iliac crest, let's pretend that this right side may be a little bit higher. I could be looking at the anterior part of her anterior superior iliac spine. Maybe I'm looking for rotation. So she does have a little bit of an anterior rotation. I could also be looking for a flare. So in the medial aspect of the ASIS. So a flare would be this type of motion. And she actually does have a little bit of an outflare on this other side here, on the right side. I can also look at the pubic tubercles. Are they elevated? So when we look at these asymmetries, what do they mean? Well, we said before that the more asymmetrical you are, the more that it affects your functional range of motion. But the key thing here is we don't know what's causing this. Her asymmetries could be due to muscle spasm. They could be due to fascial tension, joint restriction, or swelling. So we have to continue with our evaluation. So we've got to go on to the R. The R stands for restriction in range of motion. So what we do from there is we would evaluate range of motion. So I could check hip abduction, adduction, straight leg raise, maybe hip extension, maybe hip flexion, and maybe go into the rotations. So typically what I'm looking for is, does she move easy in one direction, and does she have difficulty moving in another direction? And what does the end feel like? So if she does have protective muscle spasm, typically I'm going to have almost a firm end feel when I evaluate range of motion, kind of a springy end feel. That's a typical end feel if you have fascial tension or protective muscle spasm. So again, we don't have enough information. We have to go on to the T of the objective evaluation. So the T, remember there's 3 of them. I could get into tension tests. So I can come in here and do a spring test, and she does have some restrictions on this right side. I could do a spring test on the pubic tubercle as well as on the hips. So that tells us that maybe the joint may be evolved in that area. Also, tissue texture. If I go in and I start to palpate the tissues, she may have some more thickness on the side of her dysfunction. And the final T is the tender point. If she does have protective muscle spasm, I'm going to find tenderness on this area. So now we've got the information we need. In positional release therapy, we are looking for tender points. Tender points can be anywhere in the body. We can find them on a muscle. We can find them on the origin or insertion of the muscle, a tendon, a ligament. They can be found over an organ, a bone, a suture, anywhere in the body. They're typically about 4 times more sensitive than normal healthy tissue. So how much pressure do we apply when we palpate? Typically what I tell people in my class is if we were to push on a nail like this, we kind of push as hard as we need to blanch that nail. That's about as hard as we need to do that. So let's talk about the treatment. So we've already done our ARTs, or ARTS. We've seen asymmetries. She may have restrictions in range of motion. She has kind of like a firm end feel. There's some tension on this side. Let's say she had a tender point here. So let's walk through what a PRT treatment looks like. So step number one, she's in this position, we find the tender point. And I would ask Angie, how tender is this on a scale from 0 to 10? I'm looking for something significant, like a 7, 8, 9, 10 out of 10. And typically there'll be a jump sign. So once I find that, I don't keep pushing on it, right? I just leave my finger there. So step number two is now I got to find this position of comfort. Now from your evaluation, you would have already evaluated which movements she liked and which movements she didn't like. So typically what we found, and we'll teach you these in the class, is if you have an anterior tender point, you're typically going to like flexion. If you have a posterior tender point, you're typically going to like more extension. The more central the tender point is, the more pure flexion or extension you're going to like. The more lateral the tender point is, the more side bending and rotation. So if her tender point is here, it's an anterior tender point, it's more lateral, we are going to use flexion. So we're going to come up like this, and we're going to feel for things. We're looking for biofeedback. Two ways. I'm looking for, I could sort of rub this tender point, and I could ask Angie, is it still tender? Is it still an 8 out of 10? And I'm looking for it to go down to 0. I can also feel, do the tissues relax? And then I'm going to come up into flexion. If I come up too far, she's going to begin to tighten up. So I'm going to back off until I feel it's comfortable. And then I'm going to experiment with rotation. Typically, if the tenderness is on this side, I'm going to like to rotate to that side. If I tend to go to this side, I'll feel the tension increase, and if I were to palpate it, it should get more tender. So she tends to like a little bit of flexion and rotation to the side. The third thing I can look at is side bending. So this is side bending right, this is side bending left. So typically, if I try to side bend left, it gets a little bit sticky for her. She tends to like this position here. So what we do is we fine tune until we find that exact position that if I were to push on it, there's no more tenderness and it feels soft. And I'm going to hold it here. How long do we hold it for? Typically about 90 seconds. But again, we have to wait for a release. And the release can come in many forms. So we teach you in the class that maybe she might start to feel some heat coming off her body. There could be vibration, a pulsation, any one of these things. And when those symptoms begin to decrease, we know that the body's going through a release. I'll also feel a sense of lengthening, and a sort of a lengthening and a relaxation of the tissues. And the patient may take a sigh, okay? And I also feel almost like a swelling in the area, like respiration is coming into this area, maybe an increase in cranial rhythm. Once I feel this is released, the important thing is you want to come out of the position slowly. And notice that I'm leaving my fingers exactly on that tender point, because when I come back out, I want to reevaluate that tender point, and it should be at least 70% better. Most of the time, it's not tender at all. I should also go back and reevaluate the ARTs, the ARTS. She should be better symmetry. If I looked at the iliac crest, if I looked at the ASIS, the pubic tubercles, there should be better spring tests. Okay, less tenderness, less tissue texture tension. And also, if I start to evaluate range of motion, I should see a change in range of motion. So who can benefit from PRT? This is great for athletes if you work with them, any type of sprain, strain type injury. You can work with young kids. The youngest person I've worked on was a 6-week-old child who had torticollis. The oldest patient I worked on was 99-year-old, an ex-Marine. Okay? So these techniques we're going to teach you at the D'Ambrogio Institute. We typically teach them as 2 3-day classes. We have a PRT lower quadrant class where we're going to focus on the lumbar spine, the pelvis, the sacrum, the knees, the ankle, and the feet. And the upper quadrant class, we're going to look at the thoracic spine, the cervical spine, the rib cage, the shoulder, elbow, wrist, and hand, as well as the cranium. So in the class, what do you expect? We're going to teach you general concepts and principles of PRT. We're going to teach you the anatomy and biomechanics of each region we're going to test. We're going to teach you the ARTS principle, how to evaluate the asymmetry, the restriction and range, the tender point palpation, okay? And also we're going to teach you how to apply positional release therapy to each of those body regions. We typically have lots of hands-on in our seminars, and we're going to show you how you can document your results and how you can create a treatment plan. We're going to use a lot of critical thinking strategies, and we're going to provide you with a detailed manual with lots of illustrations to help you with your learning. We're also going to put together sort of a review DVD or video that you can watch after the seminar to help you with your learning. And CEUs are going to be offered for this class, and we hope to see you at one of the seminars.